Have you ever stood up a bit too fast and suddenly felt like the whole room was tilting? That woozy head rush feeling where you have to grab onto something to steady yourself? It's a super common experience, but have you ever wondered what's actually happening inside your body at that moment? It's not just a random glitch. It's a fascinating phenomenon called orthostatic hypotension. Let's break down what that fancy term means and, more importantly, what you can do about it. So, picture this. You're sitting or lying down, totally relaxed. Your blood is circulating nice and evenly throughout your body. But the second you decide to stand up, a powerful force takes over: gravity. Instantly, gravity starts pulling blood down towards your legs and feet. This means for a brief moment, there's less blood flowing up to your brain. And since blood carries oxygen, your brain experiences a temporary oxygen dip. This is what triggers that dizzy, lightheaded sensation. It's your brain's way of saying, "Hey, I'm not getting enough fuel up here." Now, your body is an incredibly smart machine. It has a built-in reflex to deal with exactly this situation. As soon as it senses that drop in blood pressure, it sends a signal to the blood vessels in your lower body to tighten up. Think of it like squeezing a hose to make the water shoot out faster. This constriction pushes the blood back up towards your heart and brain, restoring normal blood flow and making the dizziness fade away. This whole process happens in just a couple of seconds, usually so fast you don't even notice it. But sometimes, this reflex doesn't kick in as quickly as it should. Why? Well, there are a few common culprits. The number one reason is dehydration. If you haven't been drinking enough water, your overall blood volume is lower. With less fluid in your system, it's harder for your body to adjust blood pressure quickly. It's like trying to run a plumbing system with not enough water in the pipes. The pressure just isn't there. So, that feeling of dizziness can be one of the first signs that you need to grab a glass of water. Another factor is fatigue. When you're exhausted, your nervous system, which controls these automatic reflexes, can be a bit sluggish. It's not as sharp or responsive as it is when you're well rested. So, if you've been burning the midnight oil, don't be surprised if you feel a little woozy when you hop out of bed in the morning. Your body is just taking an extra second to get its act together. What you eat also plays a huge role. While we're often told to limit our salt intake, having too little salt can also cause problems. Salt helps your body retain water, which is essential for maintaining healthy blood volume and pressure. If your diet is overly strict or you've been sweating a lot, you might be low on sodium, making that blood pressure drop more noticeable. Similarly, skipping meals, especially breakfast, can lead to low blood sugar, which can compound the problem and make you feel even more lightheaded and weak. So, how can you stop the world from spinning every time you stand up? The good news is, there are simple, effective strategies you can use. First and foremost, change your posture gradually. Instead of jumping straight up from a lying or sitting position, take a moment. If you're in bed, sit on the edge for a few seconds before standing. If you're on the couch, pause before you rise. This gives your body a head start to begin adjusting your blood pressure. Here's another great trick. Activate your leg muscles before you even stand up. While you're still sitting, try flexing your calves and thighs, or march your feet in place for a few seconds. This simple action helps to pump blood from your legs back up towards your heart, essentially preempting the effect of gravity. It's like giving your circulatory system a little warm-up. Of course, staying hydrated is key. Make sure you're drinking enough water throughout the day, not just when you feel thirsty. If you're active or it's a hot day, you'll need even more. And pay attention to your diet. Ensure you're eating regular, balanced meals. If you suspect your salt intake is too low, adding just a little pinch to your food might make a difference. But always be mindful of your overall health. Now, if you find that this dizziness is happening frequently, or if it's accompanied by other symptoms like fainting or blurry vision, it's really important to get it checked out. While it's often benign, persistent orthostatic hypotension can sometimes be a sign of an underlying issue, like a problem with your heart or nervous system. A simple blood pressure check with your doctor can provide a lot of insight and ensure everything is working as it should. Your body is always sending you signals, and learning to listen to them is the first step toward better health. This is Vital Health Daily, your body explained. Thanks for watching, and if you learned something new today, don't forget to like and subscribe for more health insights. Stay safe and stay informed.